It was good.
Awesome.
Welcome to Holistic Kids Show. My name is Zane.
My name's Odua.
And my name's Imad.
We're the Holistic Kids, here to educate us kids from the inside out. Do you hate when your parents are constantly nagging you about brushing your teeth?
Seriously!
Why is it so important to brush your teeth? Then they even want us to floss. Isn't that crazy?
Well, we have an expert in the house, and he's not just any dentist, but a holistic dentist who also looks at the whole person, not just their teeth. Dr. Seth Gilson is a action-oriented and is inspired by nature and the love displayed in others' actions. He is a practicing functional and holistic dentist and has been in private practice in South Florida since 2011. Dr. Gilson is also a certified yoga teacher since the 2019. He has backgrounds in both clinical functional medicine principles as well as clinical research in the hospital setting. Dr. Gilson has been an amazing health and sports enthusiast since his youth and has a passion for the game of soccer. He now focuses his energy on family education and the growth of the mind, body, and spirit. He's building his community and improving the lives of others. From his passion for spreading helpful information regarding the benefits of lifestyle choices founded on the principles of functional medicine and functional dentistry. He created the brand called Mindful Doctor and a show called The Art of Mindful Medicine, which can be viewed on his Instagram and YouTube channel.
Thank you so much, Dr. Gilson, for joining us.
You guys are very welcome.
It's our pleasure.
It's our pleasure.
Well, that was a great intro. Appreciate it.
So how did you go from being a regular dentist to holistic and functional dentist? We would love to hear a story.
Well, it took a little bit of time. We in traditional dental school and things like that, we all pretty much kind of learned the same basics, kind of like they do in medical school. And I've always been a bit of a health advocate, and being a soccer player and athlete growing up, I was always more health and nutrition oriented. And as I've been seeing patients over the years, I've just noticed that traditional or conventional, I'd rather say conventional dentistry is just treating problems that people have. You come in, you diagnose, and you treat, rather than looking at what the actual cause of these problems are and how it's connected to the rest of the body. So after seeing patient after patient after patient, year after year after year, I decided to do a little bit more self-exploration. I looked more into nutrition for myself, and then I wanted to apply that to the people that I get to meet on a daily basis and treat.
That's amazing.
Amazing.
So
I agree.
how are you different than a regular dentist?
Well, kind of like you guys said, functional and holistic dentistry. I mean, we use the foundation of conventional dentistry, but we use materials that are more biocompatible, meaning they are safer and your body likes them more. They work better with your body rather than chemicals that can be harmful to your body. And we look at the mouth as it's connected to the rest of the body, not just the mouth being separate from the rest of the body.
That was amazing.
So,
Thank you.
Why is the teeth important?
Why are teeth important? Well, just like any other part of your body. Why is your heart important? Why are your kidneys important? They all serve a purpose, right? Not to say that, I mean, obviously, if you didn't have a heart, you wouldn't be alive, but you can still lose a tooth. But all of our teeth do serve a purpose, and nutrition and eating is one of those really big purposes that we all need to do, right? So our teeth, really important to help us eat properly. Also, it's nice to look at somebody that has a full mouth of teeth when you smile, just like you guys have beautiful smiles over there. And the teeth are also an indication as to what's going on. The teeth and the gums actually are an indication as to what goes on in the rest of the body. So I mean, if you can see something earlier going on in somebody's mouth, like if they have moderate gingivitis, which is an infection in the gums, which I'm sure that's something we're going to talk a little bit more about, you can be sure that that's affecting other areas of the body before it gets to a point where it's really harming somebody.
So let's get this straight. What are cavities?
Cavities are basically like a bacterial infection. No real different than any other kind of bacterial infection. It's just different types of bacteria affecting different types of what are called tissues. So if you get a cut in your arm, you have bacteria in your skin and things like that, and there's bacteria in the arm, and whatever cut you is going to have bacteria on it, and that can give you an infection if it's not taken care of, if it's not cleaned, if you guys don't put medicine on it, things like that. Just like I'm sure your mom's done for you guys when you get scrapes and bumps and bruises when you guys are out playing and horsing around with each other. It's the same thing with your mouth. If you don't constantly, we're constantly putting things in our mouth, right? We're constantly eating. So those are things that's called foreign material. It's not from our body. So it's something that's other than us that we're putting into our body. So there's different types of bacteria and all those things. So that bacteria is then going to interact with your gums and your teeth and things like that. And if your gums and teeth aren't healthy, that can create an infection. And one of those types of infections are cavities, basically.
So do kids usually get more cavities than adults? And if so, why?
I wouldn't say kids necessarily get more cavities. It comes down to your habits. I mean, I know plenty of adults, of people of all ages that get a lot of cavities and some that get absolutely none. There's a lot of different factors that play into it. I'm sure we'll talk a little bit more about those, but I wouldn't say kids are more prone to it necessarily. I think maybe because adults have a little bit more of an idea how to create good habits for themselves, and kids like your age and even a little bit older are still learning how to create good habits for themselves.
So does inflammation cause cavities the same way it causes other diseases?
Not necessarily cavities, but the bacteria that cause cavities can cause inflammation in the mouth too. The bacteria that you're referring to, or the inflammation that you're referring to, is something that is more prevalent in something called gingivitis, which is just an infection or inflammation of the gums in the mouth. And then there's another type of infection that a little bit more severe than gingivitis is something called periodontitis. And that's something that gets a little bit deeper into the gums and starts affecting the jaw bones in your mouth that hold your teeth. That is principally inflammation caused.
So how can cavities affect you besides just becoming black?
Just besides what?
Besides giving you a bad looking smile.
Well, cavities can cause a lot of pain if you don't get them taken care of. If you get a really bad cavity and it reaches the nerve of the tooth, that's really, really painful. For most people, that can be very, very painful. It can cause a very bad infection. People have unfortunately died from the infections like that, and people have to be hospitalized sometimes for infections like that. So it's definitely not something you want to let go of and put off to too much later. You want to get those things taken care of while they're small and easy to get taken care of.
So what problems can kids have with their gums? Is it important to take care of your gums?
Absolutely. Just like in adults, it's very important to take care of your gums. That's why brushing and flossing is so important. So it's kind of brushing, flossing, it has a twofold benefit. It helps reduce cavities and it helps reduce gum disease. So because there's, like I said before, there's a lot of different types of bacteria that cause different things. And those not good bacteria in our mouth kind of form an alliance, I guess you could say. They work together against the good bacteria in our mouth, and they can cause cavities and bacterial infections that can injure the gums and permanently damage them.
So
how is our mouth health connected to our body health?
That's a really good question. And that's something that most people don't really think about. So let me ask you guys a question. When you eat, right, or drink something, where do you put the food or drink?
In your mouth?
Right. And then where does it go?
To your body?
Well, where does it go first? Of course, it's in your body.
Throat.
It goes to your throat, right? And then what? It goes to your tummy and in your
Yeah.
stomach, right?
Yeah.
And then once it's in your stomach and your stomach's digesting all the food and all these different things, then it goes to your intestines, and that's where all these nutrients and minerals and everything's absorbed from your stomach and in your intestines, right? So if there's an infection here in the mouth, that's going to affect everything that goes on down here in the stomach and in the intestines, right? So this is really just it's all connected. That's called our gastrointestinal tract. This is the first part of that tube. You can think of it like a tube. Just goes from our mouth all the way down. Okay? So anything that's going on here is something called dysbiosis, which is an imbalance of the good and bad bacteria in our mouth, which can cause the types of infections that we're talking about. That can translate to the rest of our gut and therefore start affecting the rest of our body, whether it's our immune system, our heart health, our brain health, different things like that.
Adults are always connecting our food, especially sugar and cavities. Is there really a connection?
Yes, absolutely. Sugar has been known for a very, very long time to feed the so-called bad bacteria that's in our mouth and in our gut, because we have something that's called a microbiome in our mouth and in our gut. And what that is basically the balance of the bacteria that we're talking about, the good and the bad bacteria in our mouth. That's called the oral. So the oral is mouth, the oral microbiome. Just like in our stomach and our intestines, we have the gut microbiome, and we have different microbiomes in different organs in our body. And sugar feeds and makes the not so good bacteria happy. And then they flourish, and then they can overpower the good bacteria, which are helpful to us. So food and the quality of the food we eat and the amount of sugar that we consume is very, very, very important for our health, mouth and the rest of our body.
What other foods are bad for our teeth?
Well, besides sugary foods and drinks, there's things called processed foods, like things that you get out of a package that isn't real food. I know your mom has you guys look at the labels of the foods that you eat. So when you turn those things over and you look at the nutrition facts, and it says stuff that you don't know what any of that means, and it basically, when you look it up, there's different types of chemicals. That's not real food. Those are things that you can consume and you can put them in your body, but it's not food. So you want to try and focus on eating things that are food. So processed foods, refined foods like white breads and white rice, things like that. Things that have gone through a lot of machine processing to break them down so they can be packaged and preserved for a really long time and then put on shelves in the stores and things like that.
So you mentioned dysbiosis. What exactly is that?
So dysbiosis. So dysbiosis. Yeah, no, that's all right. I don't think I knew how to say it the first time I saw it either. So dysbiosis is basically an imbalance of the bacteria that we're talking about. So remember I said we have good bacteria and we have not so good bacteria. So we're always going to have the two different types of bacteria, but there's a level and a balance between the two, right? And if they fall out of balance, where the bad bacteria starts to overpower the good bacteria, that's when we start to run into health problems, and we start to not feel so good. You start to develop chronic diseases and disorders and things like that.
How does our gut bugs or microbiome affect our teeth and our gums?
So like we were saying before, the microbiome, we have an oral microbiome. And like I said, we have different organ systems like in our gut that have a microbiome of their own. So that balance of the bacteria, which is the microbiome, plays an intricate role in health in all different areas of our body. So for example, if we have an overabundance of or too much of the bad bacteria in our mouth, you can develop more cavities, more gingivitis, and more periodontitis as you get older and these things progress.
What foods help our teeth? I need to keep my smile looking pretty.
I totally agree. You do need to keep that smile looking pretty. The foods that I always suggest that people eat are some fruits and a lot of vegetables. Lots and lots of vegetables because they have lots and lots of fiber, and they're full of the fiber and the other micronutrients in those foods feed our good bacteria. Just like, remember I said before, the sugar feeds the bad bacteria. So a lot of the fibers and the nutrients in vegetables feed the good bacteria.
What else can we do to optimize our mouth health?
To optimize our mouth health, well, one thing we didn't, or two things we didn't really talk a whole lot about are brushing and flossing. Well, we didn't talk about them yet, but brushing and flossing are really, really important. So what I always tell people, kids and adults, is that 80% of what you're doing, of the battle, so to speak, of oral health, is what you do at home. Brushing twice a day and flossing daily, flossing at night before you brush your teeth. Okay, that's really, really important. And then finding a holistic dentist that's close to you that you can go get your regular cleanings at and checkups and making sure that everything is as it should be.
How does stress and not sleeping affect our teeth?
Well, I know a lot of people might not think that not getting enough sleep and things can affect our teeth, but not getting enough sleep, it does cause stress on the body, and other types of stress, whether it's emotional or physical or too much physical stress, causes hormone imbalances. And then we have a lot of hormones that do a lot of different things in the body, whether it's in the gut or in our mouth or in our brain, different things like that. And these hormones and neurotransmitters and things like that, which are the messengers of the different types of hormones, tell our body what to do. So if we tell our body that we, for example, don't need to secrete as much saliva, so the spit that you have in your mouth, that's also called saliva. So if you don't have enough of that in your mouth, what happens? Your mouth gets really dry, right?
Yeah.
So when your mouth gets really dry, you're actually more prone to getting cavities. So when you stress the body out, you fall out of balance. Everything about health and chronic health is about balance. And when you create balance in all different aspects of your life, the overwhelming majority of people wind up being very, very healthy.
So we hear a lot about fluoride. What exactly is it, and what are your thoughts on fluoride?
So fluoride is a chemical. It's been used in a lot of different things, like toothpaste, for a very long time. And there wasn't a whole lot of research done on it when it was first introduced to things like water, the environment, foods, things like that, and obviously dental products, whether it's a dental filling material or things like toothpaste or actual fluoride gel. And my thoughts on it, well, I don't really recommend it to 99% of patients because I don't think it's absolutely necessary, and I think it can have negative effects in the body. And there's a lot of studies coming out that actually show that it can have negative effects in the body, and some people are more prone to those effects than others. So like I said, if someone's out of balance, if there's a lot of stress, if their hormones are out of balance, if they're not eating really well, they're going to be more prone to experience the negative effects of having an overabundance amount of a toxin like fluoride, because we're not just getting it from when we brush our teeth. It's in a lot of different products. So like I said before, it's in a lot of different water supplies. It's in a lot of different food products, and it's in a lot of different dental products. And it's in fertilizers that are used to plant our food. So you're getting a lot of fluoride from a lot of different sources, and it can have a lot of really negative effects on the body. But some people that have a lot of cavities, every once in a while, I will recommend that they use a fluoride toothpaste. But there are other products, different types of toothpaste and things like that actually work a lot better, or at least as good as fluoride.
So if a child does get cavities and needed them filled, what are things that we should stay away from?
If what? Say that one more time.
So if a child does get cavities
Mm-hmm.
and need them filled, what are things that we should stay away from?
Gotcha. So, sir, there's different types of filling materials, basically. So there's three main types of filling materials, or what are called restorations, that are used. One is a metal filling. Another one is called a composite filling. And then there's also porcelain fillings. The metal fillings, I never recommend. I never do. And I don't suggest that anybody else do them. Because a lot of the metal fillings do have something called mercury in them, which is also a toxin and can have very, very negative effects on the body, specifically people that are more prone to that. Another product that we do use very, very often is something called composite, which is basically like I don't know if you guys have ever heard of the term resin, but it's like a plastic type material. And there's a lot of different types of composites. I mean, probably thousands of different types of composite materials that we can use for fillings. But like I said before, as a holistic dentist, we try and use materials that are more biocompatible, meaning, again, that our body is okay with that material, that it's safe for our body to use these types of materials. So a lot of the composites nowadays have things like that we hear about on the news and in other areas that we don't like to have, like BPA. Like you probably hear about BPA bottles. You want BPA-free bottles, and because they're made of plastic, right? BisGMA and different things like that. There's a lot of different chemicals that are in these composites because it's basically a type of plastic material that we use for fillings. So you want to make sure that there as little or none of these chemicals in the products that you're getting for fillings. The other and the last material, which is one of my personal favorites because I think they're great restorations, are porcelain inlays and onlays. And that porcelain material is exactly that. It's porcelain. It's very biocompatible. There's no harmful chemicals in it. And they last a really long time, and they look really beautiful for people that want to keep pretty teeth like you guys.
So I have a question. What is plaque?
Plaque is basically the duty of the bacteria in your mouth. That's essentially what it is. When you let that build up, it creates something called a biofilm. No matter what, that biofilm is always there. The bacteria is always secreting these different things to create a film around the teeth. And if you don't clean your teeth properly, that film builds up and builds up and builds up, and plaque builds up. And that's one of the ways you can get infections. And that causes the inflammation that we were talking about before.
I remember when I had cavities, we were able to remineralize our teeth by lowering certain foods and using a remineralizing toothpaste that you talk about remineralizing of teeth.
Of course. So remineralizing your teeth, it can be done in a couple ways, and it doesn't always work for everybody because we always have different reasons that we get cavities. So it's really about finding the reason that somebody's getting the cavities and kind of fixing that problem first. But some of the ways in which we get cavities or remineralize our teeth is by using a really safe and really good toothpaste that has something called hydroxyapatite in it. And that is a compound that's naturally found in our bodies, and it's been shown to actually help remineralize our teeth. So there's a bunch of different toothpastes out there. One of my favorite ones that I use is called Risewell, and that's an all-natural toothpaste. It has all natural ingredients, and the main remineralizing agent in it is hydroxyapatite. Another really important way to help mineralize our teeth is the foods we eat. The food, all the minerals in our body, whether it's our bones and our organs or all the cells, all the hundreds of thousands of chemical reactions that go on in our bodies require the vitamins and minerals and all the nutrients that we eat. So the best thing you can do for your overall health, especially with your teeth, is to eat really high density, nutritious food.
What kinds of toothpaste should we look for?
So like I said, one of the brands that I really like and that I use and my whole family uses is called Risewell. I would look for all natural toothpaste. It doesn't necessarily have to be that brand, but because like I said, there are several. But I would look for an all natural toothpaste that has hydroxyapatite as the remineralizing agent.
My mom used to give us charcoal toothpaste. Should we be using that?
Charcoal toothpaste you can use every once in a while. That helps whiten your teeth, and it can actually help detox some of the toxicity that goes on in our mouth from the different types of bacteria. I use it every once in a while.
You talk a lot about mindfulness. What is that? Why is that so important for our teeth's health? Our tooth health.
Well, it's not it doesn't directly affect our teeth health, but it affects our overall health and our mental state. So mindfulness is essentially bringing peace to the moment and bringing your awareness and consciousness into the moment that you're in life, right? So I'm here now talking to you guys, and you guys have my full attention. I'm totally focused on what you guys are doing, what you guys are asking, all the little moves that you guys are making. So when we find that place in our daily life, that peaceful place in our daily life, it translates to all different parts of our life, whether it's our mental health, our physical health, our spiritual health, our relationships with other people. All of these things are really, really important for our health. And the healthier we are overall, the better mindset we have. And the better mindset we have, the healthier we act, the better habits we create, right? Whether it's movement and exercise like yoga or running, swimming, things like that, or the relationships that we create in our life. So it translates in a different kind of way, but mindfulness is key to our overall health.
Any last tips to improve our teeth? And where can kids start today?
Where can kids start today? Brushing and flossing. Definitely brushing and flossing is the easiest and practically free thing that you guys can do on a daily basis. And I know a lot of people don't like flossing, but what I tell parents and kids and adults as well, make it like a flossing party. You guys go and brush and floss your teeth together, and you check and you make sure you guys are all doing it together. The key is to be mindful of each other and make it fun. It doesn't have to be this horrible chore that you have to do. It should be something that you want to do, because when you love yourself, you want to do the right things for yourself. And when you do the right things for yourself, you feel better about yourself. And it creates a good cycle, a happy cycle. So kids, you can brush and floss on a daily basis, and you can start eating really, really well. Not that you can never have sugar, but you want to have very little sugar. And if you're going to have things that have sugar in it, make it like natural foods, like fruits. Fruits have a lot of sugar in them, but they're really healthy for you because they have all the other vitamins and minerals and nutrients and fibers and things like that.
So what do you think about oil pulling?
Coconut oil pulling is I love it. I do it probably 2 to 3 times a week. You just want to make sure you use a really high quality coconut oil when you do it. So I always recommend organic, unrefined coconut oil. I'm not so specific about the brand, but it really does help detoxify and soothe the gums. Another thing you guys can really start doing is drinking a lot of water. Water is really, really important. Every single cell in our body relies on water, but clean water. So that's a whole other conversation, clean water, but you want to make sure we're drinking really, really good quality water with as little fluoride in it as possible.
Wow, you're so inspirational. Where can people learn more about you and your work?
Well, you can come and follow me on Instagram. My handle on Instagram is @mindful.doctor. It's doctor spelled out. You can also go to my website, www.mindful.doctor. And then my YouTube channel. It's called The Art of Mindful Medicine, where I just interviewed your mom yesterday, and she's going to be on my YouTube channel when I get that uploaded.
That was so inspirational. Everyone, make sure to follow Dr. Gilson on social media.
Thank you so much, Dr. Gilson.
Gilson.
Let's
Let's
recap
recap
Dr.
Dr.
Gilson's
Gilson's
key
key
points. Your mouth is the window into your health. If your mouth is sick, you're more likely to get sick too. Your mouth has its own bug or microbiome that determine your health. So we need to take care of our smiles and our teeth. Eat the rainbow of foods and veggies that will satisfy our sweet tooth. And they're super colorful and actually make us healthier, not sicker. Eat nutrition dense foods to help our teeth. Make sure you are drinking clean water with the least amount of fluoride as possible. Make sure to brush and floss daily and find a holistic dentist. 4 things contribute to tooth decay: lack of minerals in the diet, lack of minerals including magnesium, calcium, phosphorus, and lack of vitamins like vitamin D, A, and E, and even K. Too much sugar consumption. Make sure to practice mindfulness. And how are you feeling in the moment? And incorporate breathing techniques to help you lower stress and improve your overall health and mindset.
Again, avoid sugar. If you want something sweet, use a natural sweetener like honey. Wow, Dr. Sam, that was amazing. Thank you again for honoring us with your time.
It's my pleasure, guys.
It's our pleasure.
It's our pleasure.
So I heard you guys have a joke for me. Your mom told me you guys like to tell jokes.
Yeah.
Yes.
Come on, nobody's got a joke? I know I'm putting you guys on the spot.
We're still thinking.
You'll think of one and you'll let me know, okay? But next time we talk, I want to hear a really good joke from you guys.
Okay. Thank you everyone for tuning in. Until next time, I'm Zain Ansari.
I'm Abdullah.
And I'm Imad.
Follow my family and I on social media, Holistic Mom MD, and look out for my mom's book, The Holistic RX, Your Guide to Healing Chronic Inflammation and Disease, The Pandemic Prescription, and the amazing children's book we wrote together called Adam's Healing Adventures. So check it out on Amazon. Yay! Kids need to learn from other kids. Please download our podcast on iTunes and leave a review so other kids and families can benefit. We need to work together to create a healthier future for all of us and the planet. Join us next week for another episode of the Holistic Kids Show, where kids are empowering kids.
Thank you, everyone.